Imagine feeling exhausted every day, gaining weight no matter what you do, struggling to feel that you can focus, and barely holding your life together, only to be told by your doctor that your labs are normal. I see this all the time, and I'm here to tell you normal labs do not mean optimal health. Today we're going to unpack why normal thyroid labs miss so much, why Synthroid isn't always the full answer, and how your thyroid and adrenal health are deeply connected. If you've ever felt dismissed because the numbers don't match how you feel, this episode is for you.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to the Feel Better, Feel Great podcast. Episode 163, Thyroid Healing Beyond Synthroid, what your labs and your doctor are not telling you. In each episode, we dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain. If you are new to me, please like, subscribe, and click the bell for this channel. Please remember that the information provided in this podcast is for educational purposes only. Always seek the advice of your physician with any questions you may have regarding a medical condition or health objectives. What does the thyroid really do? Well, the thyroid kind of runs your life. That's the way to think of it in a lot of ways. It's really important for how much energy you have, not just on the outside, but even down all the way to the cellular level. It's very important for heart health. It's very important to make sure that the energy gets released from the mitochondria into your body so it can be used. The thyroid also is a hormone. And for many people who've been taking Synthroid or other types of thyroid support, that's actually a bioidentical hormone replacement therapy. That's a lot of words, but bioidentical for sure, if it's bioidentical. There's a lot of synthetics on the market for thyroid, and we'll talk about that in a minute. But the hormone of thyroid is also really important for breast health. Dr. Brownstein's book, Why We Need Iodine, highlights the value of the use of hormone support for breast health. It's also really important in gut function, communicating well with the microbiome. It's critical for our moods to be stable. And of course, many of you know, because this is a very important complaint when it comes to thyroid, it's about skin, hair, and body temperature regulation. And there's a lot more to that, but I do want to say that if you're freezing all the time, you definitely have a thyroid thing going on. You might have some other things going on, but you definitely have a thyroid thing going on. And critical to understand is the thyroid doesn't do it alone. It's part of a very important neurotransmitter axis. It's called, in abbreviation, the HPAG axis. And really that's how your brain communicates with the thyroid, the adrenals, and then the sex hormones. The thyroid and the adrenals communicate constantly. And when stress overloads us, which we often think about the adrenals, but when stress overloads the system, it does drag the thyroid down. Why Synthroid isn't the full answer? This is so important. First of all, Synthroid, I'm going to tell you kind of like medical cultural situation, because the thyroid actually has been known as a problem for a long time, but thyroid medicine was synthetic. So the pharmaceutical companies in the early 80s made a synthetic hormone that was actually the inactive hormone, and everyone started taking it. At some point, Synthroid was the number one prescribed pharmaceutical agent. And while I don't love Synthroid, it is in some ways nice that the pharmaceutical industry acknowledged the value of the thyroid and produced this Synthroid product that was then used, and some people have been taking it now 50 years or more, maybe 60 years. So, no, that's not right, since the early 80s. So anyway, Synthroid, you need to understand this because the Synthroid is actually a synthetic medication that is the inactive form of thyroid hormone. And why would you have an inactive thyroid hormone given to you? Well, the theory, and as we're taught in medical school, is when you have the inactive, then when your body needs it, it can convert to active. And I just want to put a big X on that thought, right? Because it just doesn't make sense. Unfortunately, it was taught to me when I was in med school in the 2000s, so 20 years ago. And I wonder if it's still taught that way. I'm not sure. But anyway, if your doctor says that to you, right, well, it's the inactive form, so your body will use it when you need it. No, that's not the case. It's kind of like having a lot of money in a savings account that you don't know what the bank is and you don't know what the account number is, right? That doesn't not going to work for you to be able to access that resource. So think about Synthroid for a lot of people that way. Okay, so it's again, the inactive form is called T4. All right, so T4 must convert to T3, which is the active form. Okay, and T3 is actually the workhorse for the thyroid, and it's very active. Again, what's the argument in giving the inactive? Well, if you give the active, you might actually get everybody all jazzed up and going and thinking and working. Oh, and then their thyroid could become hyperactive. Right. I mean, yeah, possibly. And it's something to look out for and be aware of an overactive thyroid. And that's a big deal when it happens to people, but for a different reason, right? It's very unlikely that you're going to be like, oh no, I have a perfect weight and I love exercising and I stay calm when I'm in arguments and it's like all the amazing things and my heart's feeling good and I don't have any breast cysts and my periods are regular and, all these wonderful things. My gut works perfectly. Like, oh no, I don't want any of that. So that's how the active form can help you. So again, that's really important to understand because you might be absorbing the thinking of the doctor you're working with, not understanding the background, and in my consideration, kind of the ridiculousness of it. And one of the reasons too could be that compounding pharmacies for a long time could offer T3, and in effect that actually then doesn't allow for the pharmaceutical companies to sell you a product. So by saying we can just give you T4 and that's all you need, it kind of fueled the system. It wasn't true. It's actually wildly inaccurate. But doctors then would only prescribe Synthroid and no one would look to a compounding pharmacy. In fact, that's, really where you need to be understanding that was the impetus for having T3 and T4 together. Now you can get T3 and T4 together at a standard pharmacy. And it's been like that now for quite a few years. So we got to change the thinking and you need to understand the background for the thinking. At least that's how I believe. Okay, because again, if you have, any kind of difficulty in converting that Synthroid and inactive hormone support, T4, then you're not going to be able to access the resources of your thyroid, and that medication is particularly useless to you. So if you have stress, gut issues, liver congestion, it's very likely, in nutrient deficiencies, it's very likely you're going to have difficulty converting. You're going to be a poor converter. And you could kind of take as much Synthroid as you want, don't really, but just, in argument, so that, because it's not going to work for you. And then also, if you have high cortisol, that's going to block the conversion as well. So if you're stressed out, super stressed out, your body's going to block that. If you have lots of inflammation, it's going to block that conversion. So if you're stressed, inflamed, or your gut's off, you could be taking Synthroid faithfully and still feel terrible.
Yeah, I think that's a good point. Actually, in the clinic specifically, we have patients that come in and they're like, they have all of these symptoms. They've been taking Synthroid for I don't know how long, and they're still exhausted. They still feel terrible. And I think with some of the labs that we offer and things like that, they kind of start to see, that light. And it's pretty incredible, just that change.
Mm-hmm. Mm-hmm. And then, of course, we know that there's a lot of information that a lot of people are not getting from their doctors. So what labs your doctor isn't running for you about your thyroid really matters. Most doctors are only checking the message from the brain to the thyroid, and that's called thyroid stimulating hormone. The thyroid is stimulated by the messages in the brain to tell the thyroid to work. What labs your doctor isn't running about your thyroid is really important. Most doctors only check thyroid stimulating hormone. That is the hormone that the brain sends to the thyroid, okay? It's the messenger from the brain to the thyroid. But there are many things that matter within the thyroid, and that is free T3, that's the active hormone, that's the workhorse. Free T4, that's the inactive hormone, right? But it needs to be there in sufficient quantities so that you start getting going and you have something in reserve for you to rely on in that conversion. Then you have reverse T3, which actually tells us if there's something that looks like thyroid and looks like those elements, but is actually a blocker on the receptor. The other thing we want to look at is antibodies. Very important about the thyroid. There's a few different antibodies. So those are different messengers from the immune system. And then we want to look at other nutrients. So nutrients like iodine, zinc, selenium, lithium can also be important. Oftentimes I use them as a second tier of lab values. I will also use though ferritin, vitamin D, and of course cortisol levels, either a morning blood level or a salivary test that will test all 4 points, because the cortisol tells the thyroid what to do. The adrenals dictate and are the boss of the thyroid. So we do have to look much deeper than the brain's message to the thyroid, which is TSH, because TSH is just your brain's request for your thyroid hormones, not how much active hormone is available to your cells. Well, then what are the root causes of thyroid dysfunction? Great question. First of all, my number one answer is going to be chronic stress, adrenal over either hyperstimulation or adrenal fatigue or adrenal exhaustion. So when that happens, we can definitely have some thyroid suppression, right? So, and also anything else that's making the thyroid overwork. This is going to lead to thyroid dysfunction. So gut infections and leaky gut, that's a lot to do with inflammation. Nutrient deficiencies. Low thyroid hormone production can happen if there aren't the right nutrients. So again, that's iodine, zinc, selenium, and then you look at some other hormone precursors like vitamin D. Clearly, if there's hidden infections, there's an immune obligation. We can start having constant immune activation. That can do a lot of root cause problems for the thyroid. And then, of course, trauma, emotional stress, and burnout. These directly slow down the thyroid function. So patterns that I see in practice, I often see patients who have a normal TSH, okay, but a low free T3. Now, what is a normal TSH? I'll tell you, it's not what your doctors are looking at. Because it's a much more optimal range. It's a narrow range. And what your doctor is looking at in their pattern is the population reference range. So they're going to have a very low to a very high number. And I've seen it as high as 16 as the reference range. But that has nothing to do with optimal health. It's just the reference range. Then we look at, okay, low free T3. Now, why is that important? Because T3 is about releasing energy from the mitochondria. It's a critical value. It's how you really get to burn your energy and use it and then fuel your metabolism. So low free T3, we definitely want to support that. So there, someone's actually getting Synthroid. So they have a normal TSH, they have a normal T4, but the T4 is the inactive form. And then they have a very low T3, so they don't actually have an actively functioning, metabolically healthy thyroid, okay? When I see low cortisol morning levels, so the person is exhausted, they're tanked. Well, if their adrenals and their cortisol are tanked, their thyroid's going to be tanked. And so you can fiddle kind of all day and all night with the thyroid. But, and that's what I see too. People come in, they've been in here, they've been on thyroid for years. They still have all the same problems. In fact, they're worse because we've been banking on the thyroid, but the adrenals boss the thyroid around. And so whenever I have someone come into the practice and they've been on all these like wonky prescriptions for thyroid, and they've been on like take 60 of this every other day and 75 every other day, and then don't take some on Sundays. And I'm like, what are you even talking about? Like, let's standardize your dose and let's look to the adrenals, because if you're up and down and all over the place with your thyroid, you've got to support those adrenals. And I know that sounds like a big deal, like, oh no, that sounds like adrenal exhaustion, I don't want that. Look, I totally get that, but the idea is, playing in the wrong field, right, is not root cause treatment. Also, I see people who are wired but tired. The wired and tired problem and syndrome is that they can't sleep and they're exhausted during the day. And then their thyroid is completely thrown off. Again, this is an adrenal problem, right? And when we dig deeper, patterns start popping up everywhere. And that's when we realize that we get real health going when we look at these deep cause solutions.
Yeah, it's so true. I think we notice a lot within our patient base that there are, patients that come in with a lot of adrenal issues, but it's all covered by their thyroid. Like there are even patients that come in that have thyroid issues that have been wired and tired or things like that, and they don't know what is going on. So it's really impactful to be able to start to link those things together so that people can start to kind of bridge that gap, because it's definitely a difficult thing to navigate, especially if you don't know what is going on.
And I can tell you of, that 7+ years of having this practice now, I've seen one person with a real thyroid problem. Everybody else, you have to look, at what's going on, because solving a thyroid problem here is like cakewalk. I mean, super chill, super easy thing to do. And it's happened one time where I was like, yep, let's switch you from Synthroid to a T3, T4 combo and have a good day. And then, but most people, it's really, you've got to look at the gut and you've got to look at the adrenals and you've got to look at nutrient deficiencies, because they've been told it's their thyroid for so long that if there was their thyroid, they'd already have this solved, but it's not. And that's probably what you're dealing with too. If this really resonates with you, is like, oh my gosh, I've been calling it a thyroid problem for 20 years, but it's not been a solution, right? So if it's not a thyroid solution, then it's probably the problem is not the thyroid.
Yeah, we also have people that come in for the lab draw specifically, and they're like, oh, I have thyroid, so you're going to check my T3 and my T4, and then they're very surprised with how many things we actually do draw, specifically because of looking at more than just thyroid markers and looking at more than just a T3, T4, or when they come to you specifically, they only have those levels for you. And then you're like, okay, well, we need more because there's more to this than just T3, T4.
Good point, Rochelle. So we have a little challenge. First of all, if you're interested in learning more, episode 128 on improving organ performance and thyroid health, that's available. We'll have that linked in the show notes. Here's your empowerment challenge for our members of the Feel Better, Feel Great podcast membership. Print your labs, even if you're told they're normal. Then compare your labs to our thyroid and adrenal guide. Look for what's missing, not what's technically in range. And then ask yourself, am I surviving or am I healing?
Yeah, I think this is going to be a really impactful challenge. I think people, like I said, are seeing green levels or something with their T3, T4, but they're not really seeing the full picture. So this will be very impactful, I think, for people if they take that challenge. But yeah, I have a question to kind of sum this all up. So if someone's listening today and they're feeling totally overwhelmed by this new information, what's one simple place that you would tell them to start?
Well, one simple place that I would tell them to start is to recognize the fact that they can believe themselves. So believe the fact that something is wrong, and someone's telling you something's right. It's not true. Okay, so believe in yourself. That's always the first step. The second thing is, consider joining the Feel Better, Feel Great membership, our podcast membership, because I would love to serve as your guide in your health journey. I don't want you trapped anymore into these places where people don't believe you, or you're not making progress, and your years are passing by and you're not really living your life. So I guess that's two parts, but definitely I believe you. I believe you in the membership. We have guides to support what you believe. That's really important. And real healing doesn't happen just chasing perfect lab numbers. It happens when you build trust with your body and address the deeper imbalances that have been ignored. Maybe not ignored by you, but actually you find a problem, but you don't have the resources. You don't have the guide, and you're keeping told that you're normal, which is even more challenging because that's a dead end. If you're listening and feeling unseen, you're not crazy. Your body is talking to you. Keep listening, keep believing in your ability to heal. And I want to be with you every step of the way. Thank you for joining us today. Thank you for joining myself and Rochelle, our podcast producer, as we explored healing your thyroid. I hope you found the insights valuable and feel inspired to apply what you've learned to your daily routine. Again, if this topic resonated with you, I'd love for you to subscribe to our podcast, leave a review, share it with friends and family who might benefit from this discussion. Thank you so much.